Now we're going to talk about application and use of a gait belt. The gait belt should be used for every patient, every time. There is not a good excuse not to use a gait belt. The gait belt should go around the patient's abdomen and it should anchor underneath the rib cage. The gait belt needs to be tight enough so that it doesn't slide if you grab it. If it slides, we're at risk for causing increased friction on the skin or causing a skin tear. This is a gait belt. We have a buckle and we've got the tail. The gait belt needs to go around the patient's abdomen. Lift your arms up. It needs to go below their rib cage. So this is the bottom of the ribs. The only time that we do not put this below the rib cage is if they have an incision or they have a line like a peg tube or an ostomy. In that case, we put the gait belt higher. I'll demonstrate both. We put the gait belt around their abdomen and it needs to be tight so that it's not going to slide. Know that when the patient stands up, the gait belt is going to be looser because their gut is not going to be stuck out as far. This is the proper application of a gait belt. We put the gait belt up high because of an incision or a line around the abdomen. Put the gait belt under the armpits. We're going to put the gait belt across the chest. So for a female patient, you want to make sure that it's above the level of their breasts. You're going to tighten the gait belt in the same manner.